the chair of that committee, Senator Rand Paul, has stated he wants him in jail. I mean,
Mexico has 15 times the amount of measles per capita that we have. Canada has 4 times the amount of measles. England has 2 times the amount of measles. Did I cause those measles outbreaks?
You're the most famous.
Did I cause 137,000 cases?
You're the most famous vaccine skeptic on the planet.
Welcome back. Capitol Hill is back in the spotlight this weekend as the fallout from high-stakes congressional investigations into the federal government's COVID-19 response continues to intensify. Today, we are taking a closer look at the fierce political and legal clashes unfolding on Capitol Hill, including dramatic moments of witnesses invoking their constitutional rights, sparking a fresh wave of debate over accountability, pandemic policies, and the legacy of top health officials like Dr. Anthony Fauci. Joining us to break down what these latest developments mean for transparency and the ongoing investigations is guest analyst name. Let's dive right in.
Your response to this week, especially since you joined us many times on the show during the pandemic, helping people navigate everything that they were experiencing. What did this moment, I guess, do or compel in you?
Yeah, I think one of the biggest concerns is that it's sad that he had to go there and do that, right? It is sad that he had to plead the fifth so he didn't end up perjuring himself. And that's what I'm understanding his lawyers told him to do. It's because the chair of that committee, Senator Rand Paul, has stated he wants him in jail. I mean, Senator Ron Johnson has said this. Senator Tuberville in Alabama said when he's governor, they're going to try to find state charges and make sure that he's either in court or in jail for the rest of his life. And so he's under attack for the fact that he was the face of the COVID response, right? Did everything go perfectly? No, he will tell you that. The people that he's trained in his life, people across public health, it did not go perfectly. Did they do everything they thought was exactly correct in the moment to prevent illness, to prevent death? Absolutely. I have no doubt in my mind that the intentions of every action that was taken was to spare people's lives. And we saw it. I mean, I remember I've been seeing a lot of people with these hearings going back and posting pictures of them in full gear with masks and gowns and all of that, and saying, people want to kind of memory hold this and pretend like it never happened. We were there. We saw it happening. We saw our neighbors and our family dying from this. And they're just, these senators in this political theater are absolutely missing the mark. And they're ignoring the real crises going on right now. People without insurance, measles, cyclospora. They're ignoring what's really going on that we need to be addressing.
So another day on Capitol Hill, another hearing where things get entirely off the rails. You've probably seen the clip circulating. Frederica Whitfield over at CNN covering the latest fallout, bringing on Dr. Rob Davidson, and diving into these intense congressional investigations into the COVID-19 response. If you watch this segment, what really jumps out is just how deep the canyon still is between how different sides view the pandemic years. On one side of the aisle, you've got lawmakers leaning hard into oversight, demanding answers about mandates, origins, and the massive disruption to everyday life, pointing the finger straight at public health figures like Dr. Anthony Fauci. Then, on the flip side, you have defenders and medical professionals arguing that this whole thing has morphed into partisan theater, a political tool to scapegoat people who are trying to navigate an unprecedented global crisis with moving targets and limited data. What's fascinating to break down here isn't even just the politics of it anymore, it's what it means for trust. When you watch witnesses invoking their constitutional rights or lawmakers clashing over decisions made years ago, it forces a real question. Are we actually looking for accountability and lessons learned so we can do better next time? Or are we just weaponizing the trauma of 2020 for political points? Every time one of these hearings happens, it feels less like a fact-finding mission and more like a referendum on history. Half the country looks at the pandemic response as government overreach that trampled individual liberties, while the other half sees a public health army that was under attack simply for trying to save lives. And the scary part is, with trust in institutions at an all-time low, we haven't figured out how to bridge that gap. Because when the next real public health emergency hits, and it eventually will, how is anyone supposed to trust the guidance when the entire playbook has been dragged through the mud like this? Let me know what you guys think in the comments. Are these congressional hearings actually uncovering necessary truths, or is it all just political noise? Hit subscribe, and I'll see you in the next one.
Measles cases in the U.S. just reached a 35-year high. The second record-breaking year in a row, 93% of these cases are among the unvaccinated. The outbreak is happening on your watch. And even before becoming HHS secretary, for years, you have been one of the leading voices questioning the efficacy of vaccines. Do you accept some responsibility for this measles outbreak?
Absolutely not. First of all, this is an international outbreak. So, and we're doing better at handling it than any country in the world. Mexico has 15 times the amount of measles per capita that we have. Canada has 4 times the amount of measles. England has 2 times the amount of measles. Did I cause those measles outbreaks?
You're the most famous.
Did I cause 137,000 cases?
You're the most famous vaccine skeptic on the planet.
Let me tell you, because actually Anthony Fauci in his diaries answers the question about why we're having a measles outbreak right now. The reason we're having a measles outbreak because of the COVID lockdowns, because people children during that period did not get vaccinated. And in his diaries, he says this is going to cause massive outbreaks in measles and more children, he says this, are going to die. Let me finish, because you accuse me of something. Now let me.
No, I didn't. I asked you a question.
Yeah, let me give you the answer. He says in his diaries, more children are going to die from measles because of these lockdowns than COVID. So if you want to know, and that age group that should have gotten the MMR when they were 18 months and didn't get it, they're the ones being infected. The people in this country, and we have stopped the outbreaks at record speed in South Carolina, in Texas, in Utah, in Virginia. We've done better than any country in the world. I dispatch immediately the epidemic intelligence services to those states. I get on the phone with the governor and we stop them in their tracks. Nobody else has been able to do that.
You have a bully pulpit.
Let me tell you just one last thing.
Go ahead.
The communities that are suffering from measles are almost all religious communities that just don't vaccinate. The Mennonites have not vaccinated since 1796, since Edward Jenner invented the smallpox vaccine. It's hard to blame that. I mean, as much as you want to blame
No, I don't want to blame you. I'm asking you because you have a very powerful voice on these issues for people who are skeptical. Let me finish. Let me finish.
And I've never questioned the efficacy of the MMR vaccine.
Okay, let me finish.
What
I want you to do is please use your bully pulpit to right now, as we're getting close to back to school, are you willing to say to parents who have not vaccinated their kids that they should vaccinate their kids for measles because it is safe and it will help them save their children's lives?
We tell people on my websites, my public
right now, look into the camera.
Now that parents should get their children vaccinated for measles. A measles vaccine is effective. It stops measles in about 97% of the cases. So people should get vaccinated.
So, if you thought things couldn't get any wilder in public health politics, look at what just happened on CNN's State of the Union. Robert F. Kennedy Jr., the Health and Human Services Secretary, who has spent years as one of the most prominent vaccine skeptics in the country, actually went on national television and told American parents they should get their kids vaccinated against measles. Let that sink in for a second. The guy who built a massive platform questioning the safety and efficacy of the MMR vaccine is now using his official role to tell families to get the shot. And the context behind it is just as intense. This came down during a really tense interview on CNN as the U.S. crossed a grim milestone, recording over 2,300 confirmed measles infections for the year, pushing numbers to levels we haven't seen in over 3 decades. Dana Bash pressed him hard, giving him the chance to use his platform to speak directly to parents ahead of the school year, and he finally said it. Parents should get their children vaccinated for measles. Now, before anyone thinks this is a complete ideological U-turn, it gets messy fast. When asked if he took any responsibility for the surge in cases, given his long history of pushing vaccine skepticism, RFK Jr. flat out said absolutely not, blaming the outbreaks instead on international travel and specific communities with low vaccination rates. As a content creator breaking this down, it's a staggering political and public health paradox. On one hand, mainstream health experts are quietly relieved that the nation's top health official is finally explicitly telling people to get the MMR shot, while cases spike to 35-year highs. On the other hand, public health advocates are pointing out the massive whiplash. You can't spend years sowing doubt about immunizations, undermining institutional trust, and changing vaccine recommendations, and then pretend your rhetoric played no role when preventable diseases make a massive comeback. It highlights just how fractured our relationship with public health information has become. What do you guys think? Is this a welcome shift in tone from the top health official, or is it too little too late after years of mixed messaging? Drop your thoughts in the comments, hit subscribe, and I'll catch you in the next one.